So these three abstracts, they are about the use of carfilzomib, Revlimid, and dexamethasone, and two of them focuses on newly diagnosed myeloma, and one of them focuses on smoldering, high-risk smoldering patients. I think the first study I would like to address is the one by Dr. Korde et al. I think it's important because it replicates the findings from Jakubowiak's study that was published in the Blood Journal in 2012. And we now see for the second time that these tremendous results, they seem to hold up in the newly diagnosed population. Also, there is a lot of correlative science showing that the depth of the response is there with minimal residual disease negativity in virtually every patient obtaining complete response. I think that's a very strong finding. The second study is a follow-up study on the Jakubowiak study by the same group that published the first study on this regimen in newly diagnosed. I think this study is very important. They publish in this abstract because they look into those few patients who don't have the benefit of this therapy. They show that having adverse cytogenetics and molecular profiles with an array of gene expression, they can detect signal of adverse disease that may or may not really respond to this therapy. I think that's an important finding because we really need to know what patient may need some other therapy. Can we identify those patients early on? And the third abstract, it's an abstract that I'm presenting myself using the same regimen for high-risk smoldering. And when we designed this study, we were not really sure whether we will be able to improve based on these very good results that Jakubowiak had published in 2012. We have treated 12 patients, and this is a pilot study, and they all have high-risk smoldering myeloma. And we see that all patients obtain a complete response or stringent complete response or a near complete response. And that's of course very, very remarkable. So 12 out of 12 patients obtain this deep response. And the last thing I want to say is that 11 out of these 12 are MRD negative using flow. So that's even more surprisingly positive.